Hey everyone, welcome back to the channel. In today's video, we're diving into an important health topic: the difference between bacterial diarrhea and viral diarrhea. Both can leave you feeling weak and miserable, but they have different causes, symptoms, treatments, and ways they spread. Knowing the difference is crucial for proper care and prevention. So if you've ever wondered how to tell them apart and what to do if you or someone you know gets it, stick around, let's get into it. Bacterial diarrhea is usually a diarrhea within a few hours to a few days entering the digestive system, usually through contaminated food, water, or contact with infected people or surfaces. These bacteria release toxins or directly damage the lining of the intestines, leading to frequent, loose, and sometimes bloody stools. Properties of bacterial diarrhea. Caused by bacteria such as E. coli, Salmonella, Shigella, Campylobacter, or Vibrio cholerae. Onset. Symptoms usually appear within a few hours to a few days after exposure. Stool appearance. Can be watery, sometimes with blood, mucus, or pus. Associated symptoms. High fever, severe abdominal cramps, nausea and vomiting, dehydration, fatigue. Duration. Can last from a couple of days to a week or more, depending on the severity and treatment. Treatment of bacterial diarrhea. ORS 2. Antibiotics 3. Medications 4. Diet 5. Rest. What is viral diarrhea? Viral diarrhea is a type of diarrhea caused by viruses that infect the stomach and intestines, leading to inflammation and digestive upset. It's one of the most common causes of diarrhea worldwide and spreads easily from person to person, especially in crowded or unclean environments. Properties of viral diarrhea. Caused by viruses such as norovirus, rotavirus, adenovirus, and astrovirus. Onset. Symptoms often appear suddenly, usually within 12 to 48 hours after exposure. Stool appearance. Watery stools, usually without blood. Associated symptoms. 1. Nausea and vomiting 2. Mild to moderate fever 3. Stomach cramps 4. Headache and body aches 5. Loss of appetite. Duration. Usually lasts 1 to 7 days and often resolves on its own. Treatment of viral diarrhea. 1. Hydration 2. Antidiarrheal medications 3. Antiemetics 4. Diet 4. Rest.